What is it like to serve in the heart of Africa? Our guest today is Echo VanderWal. Her and her husband, Harry, lead the Luke Commission, which is a faith based NGO that provides compassionate, comprehensive, free health care to the most isolated and underserved people in the kingdom of Eswatini, which is over 300,000 patient visits a year. And so today I've invited Echo to share a little bit about their mission, what they do, how they do it, what inspired them to do it, and how they're also equipping leaders to transform lives in a very powerful way. So Echo, welcome to Leaders of Transformation. We're glad you're here today.
Thank you very much. Thanks for having us.
It is an honor and a pleasure. I do want to do a shout out to Kristen Cole before we forget. Kate Cole Communications. She's the one that introduced us. And so, Kristen, thank you for the introduction. You help us just have amazing guests on the show. And I just so appreciative of everyone who supports this show, the booking agents, of course, the people that are on the show, the guests, and of course, all our listeners and viewers. We're glad you're here today. And I just, I hope that this inspires you and it motivates you. Maybe even there's something that God has placed on your heart that you're wondering and thinking, maybe, should I not do this thing? I have something that is heavy on my heart that I want to go out and serve in a certain way. And I hope that this really inspires you to take action on that, to step out on faith and do the thing that you're called to do. And it's not necessarily going to be easy, but it'll be worth it, I'm sure. So, So Echo, with that in mind, what inspired you to start the Luke Commission?
Well, when I was 8 years old, I felt called to work overseas in healthcare in Africa. And thankfully, I had parents who didn't make fun of that. It's easy to maybe dismiss what kids say, but for me, I've learned that at times God plants seeds in people's hearts, even when they're kids. And so when I was 8 years old, I felt called, and that didn't change. And then when my husband was 17, he also felt a similar calling. We met when we were 19 at university, and married when we were 21. And then we went through medical school and our postgraduate training and finished when we were about 30 years old. And someone introduced us to the country of Eswatini, formerly Swaziland. And my husband and I actually boarded the aircraft to Eswatini on the 19th of September 2004. So it's almost 2 days from now will be 20 years. For the first time, our feet hit the soil in Eswatini, and we dropped into the middle of the worst of the HIV pandemic. And someone took us to rural communities, and we saw people in houses everywhere. They were dying, and especially young people in their 20s and 30s. And there were children all around who were orphaned from HIV. And we started really just listening and asking questions. Why do you feel like you can't access healthcare? And we heard three main challenges. One, transport. And I think, I grew up in a poor family, so I guess I can relate to this to some extent. But what we saw is that we saw people who were having to choose between feeding their children and boarding a bus to go to the hospital for healthcare. And I think all of us with kids, or anyone who's taking care of kids, know that you're going to choose feeding the kids first before you prioritize your own health. And the second thing that we heard is that oftentimes when they did make it to the hospital, there weren't the medications or supplies that they needed. And the number three thing that we heard is that people felt stigmatized. And it seemed there was a desire for compassion to be the cornerstone or the bedrock of how healthcare was delivered. So at the time, my husband and I had triplets that were 3 years old and a 2-month-old baby, all boys. And we felt that God was calling us to go back to Eswatini. So as soon as he finished his residency, he's a doctor in internal medicine and pediatrics. Then we went to live in Eswatini full time. And, now we have 6 children, a grandson. Our oldest son is married. Crazily enough, all of our kids have chosen to stay in Eswatini and work with us. They've graduated from Liberty University Online School, which has just been a really great dovetail into them being able to continue to work and serve in Eswatini. But really grateful. Just a bit of a reflection in this 20th year looking back.
Wow. Well, and to bring a young family like that into an environment where there's so much uncertainty, maybe in terms of like, how are you going to handle that? What were the thoughts that were kind of going through your mind? I'm thinking something like sometimes we have this desire to do something and it's like all the things that we say or the thoughts that talk us out of it because logically it doesn't make sense at this time. But you just stepped out and said, yeah, we need to do this. And it's amazing.
Yeah, it was a big blind leap of faith, I'll say,
Yeah.
and it's been pretty much one continuous blind step of faith after another. But recognizing, we really felt that God would give us direction once we took the blind step of faith. And so
Mm,
that's I think characterized a lot of our time there. For the first 8 years, my husband and I were the only medical providers, and we were working with a team of 20 Swazi staff. But today we have 700 staff, 35 doctors, doing things like joint replacements and very complex eye surgeries and things that were otherwise not available in the public healthcare system in Eswatini. And so, those blind steps of faith have culminated in pretty amazing just to see what God has done over this time. But I really appreciate your focus on, leaders of transformation, because really that's been the biggest, I would say, focus for my husband and I, recognizing it's not about us. God may have used us to push a seed in the ground, but to impact a nation, you don't do it alone, and you don't do it with foreigners. So that, capacitating a national team that has the resources that they need to be able to serve the nation in a way that is bigger than all of us has been just really the main focus of our past 20 years in Eswatini.
yeah. Yeah. It's interesting you say that because I've heard others say that. It's like, oh, the missionaries are coming, but what about nationals? What about equipping people there? So how do you do that? Like learning the language? It's only you and your husband, like you said, for a number of years. How do you inspire people to come alongside you in that? I mean, obviously there's paid staff and there's volunteers. Tell us a little bit about that journey.
Okay. Well, I would say that we probably took a little bit of an unorthodox approach.
Okay.
Uh, and I'm sure there's many ways to do this, but we felt very called to work alongside, shoulder to shoulder with the
Mhm.
staff. And there was a lot of years invested in just relationship building. And then we also have been very careful to have, even we only have about 10 Americans that work with us.
Okay.
They've all been there for a decade or more, super invested, super committed. But 97% of our staff are local staff from
Okay.
Eswatini or surrounding countries.
Mhm.
And that's been the focus of our leadership development and capacity building. Is it messy at times? Yes. But there's really nothing that can compete with the impact that we have on our own people. We just whatever culture you grew up in or you were born into, you understand in a way that we will never. Even our children, I realize that they spent their formative years in Eswatini. They understand things at a deeper level than we ever could. So those
Mhm.
formative years, I just think, are so important, and that's the role I would say that the national team plays that we could never play. So for us, we've always seen this as an interdependent relationship, not like the missionaries are coming to save the day. In fact, we don't even call ourselves missionaries. We just believe that God called us to work alongside and hold hands with people. And when we see areas where maybe we could support, we do. Where we see areas we can capacitate, we do. Where we see areas we can give a platform, we do. And I just am, like really, really, really proud of the team. They've led through several, I would say, crises, especially in the past 5 years, national level crises, especially during COVID, when most of our hospitals could not receive ICU patients. We took care of 90% of the ICU patients in the country. And they just did it with resilience and depth in a way that I can't explain. I know we were watching miracles. On the other hand, I do think those many years of relationship building at the beginning where the trust is built is so crucial and critical. And there's really not a way to fast track it. I would say, looking back on it, you just don't
Mhm.
fast track trust. You don't
Yeah.
fast track relationship building. And so there's no easy steps that I can give except, I agree with how you open. Like, if you're called to this, jump off the cliff. If you're called to something, jump off a cliff and see what happens. Thankfully, I married someone who always had the attitude that if we fall down and we mess up and we fail, we're going to get back up, brush ourselves off, and go on. That failure was not a deterrent from trying. And I think that that's been really key. We've made a lot of mistakes. Done things that we would do differently now, but being willing to just get up and not see failure as failure, but as the next step to where to the goals that you feel called to, I think has been really critical for us to be able to navigate in a country that's complex. We're a complex kingdom, and with complex undertones politically, and so navigating those things is not something that you do by book or by strategic plan. You do it step by step, and for us, working very interdependently with the national team has been the key for us to make it, I would say, 20 years, and really to establish Eswatini as our home country, because we really don't see the United States as our home country anymore.
Yeah. Wow. Well, I'm glad that you talked about the failure piece, because I think a lot of us, especially in the Western world, we kind of are taught that there's strategy, especially in business, because I know you have a lot of business acumen and leadership acumen, obviously, as well. And it's like, okay, we're going to plan this out, and this is how it's going to go. We're going to have projections, and we're going to do all these things. My experience, and we were talking about that even before we started this recording, it's like, I'm not on my timing, I'm on God's timing. When I'm partnering with him and what he's doing, it always turns out better. Mm-hmm. And it's just having the faith to do it maybe in an unorthodox, what seems like an unorthodox way, because the way that we've been doing it gives us a certain result, and it's a very human led result. And there's just things that we just don't know. I mean, I always say that, like, to clients, because I coach clients and, entrepreneurs and so forth. And I'll say, like, look, God is the best business partner you could possibly ever have, because he knows where all your clients are. He knows where all the pitfalls are. He knows the best strategy. I mean, it doesn't get any better than that. It's just the challenge is trusting and letting go of our own framework of what we believe how it should look, and even failure, right? So, like, it's like, we're not supposed to fail, we're supposed to succeed. And it's like, well, that's actually not how we learn, that's not how we grow. And usually, we fail our way forward. So I appreciate you saying that. I want to go back to something, because you talked about in the beginning, when you first went and visited with your husband, you noticed that there was some issues, like, for example, having to choose between feeding their children or going for health care. How have you resolved those things? Because you have, like you said, hospitals, but what about those that aren't able to make the trip? And how do you support the different people that might be in super rural areas and maybe inaccessible?
So, of course, it's morphed over time, but initially, all of our work was actually mobile. So we went to the people, recognizing how critical it is for people to, especially with HIV, to start treatment early. Waiting until you're sick is a partial death sentence in many cases. Mm-hmm. So, trying to bridge that gap, we really felt called at the beginning of our time in Eswatini to the delay of orphanhood, meaning that parents need to be on medication, on time, early in the disease process, so they can live to raise their own kids. Because as much as we can talk about children's homes and orphan strategies, the best thing is that parents raise their own kids. So that's where we saw our work on the continuum. Not saying that children's homes are not important; they are very important. But we saw this challenge, and going to the people was really critical. Then over time, God opened the door for us to be able to buy about 150 acres in the center of Eswatini. And also, as our time progressed in the country, recognized that there were things that obviously needed a fixed facility, operating rooms and those kind of things that you cannot do on a mobile basis. So based on those relationships that were built, because there's about 316 chiefdoms in the country, so you're building relationships with all of those chiefs, and the local structures, community-led structures.
Wow.
They refer people to us at the Miracle Campus, the centrally located. We're right in the center of the country, where people come for more extensive care. So that's kind of how the progression happened. And yeah, it's just we we've really pushed the use of technology to build efficiencies. You talk about how do we reach the most remote areas. I mean, our team just like doesn't see anything as something that can't be done, which is part of what I love about them. They dream, and I want to go back to a little bit of what you said. I do feel it's important to fail, but I also feel that it's very important to be intentional about strategic planning.
Mhm.
And the way that we've approached that is we've always been very careful about our 5-year strategic plans and, having those things in place, but being willing for God to sideswipe it. I feel that that positions you to be able to take advantage of opportunities, doors he opens when there's intentionality about the strategic planning. So I don't think that that part is bad. Sometimes, we kind of look at it as an either or, and I think it may be more of a mix. But just to speak to that, I think that's given our team a platform by which to dream. So one of my sons actually started dreaming many years ago when he was 10 years old that if he could put something at the time was a flying car that he saw at this conference. And if you could put this flying car in the air, then you could take certain kind of drugs and commodities to rural communities when they needed them. For instance, one of our big issues in the country is snake bites. We have a very deadly snake called a black mamba, and it has paralyzing side effects. So once you get bitten, it actually paralyzes your diaphragm. You can't breathe. So this is, he's seen this his whole life. And so he saw these cars. Of course, it didn't get out of prototype. But then when drones started being more of a reality, we put drones in the air in November of 2023, and are now flying a drone program to take snakebite anti-venom, oxytocin for women after they give birth and possibly they're hemorrhaging, things that are very high value that are hard to stock in the whole country in every facility, but you can easily fly it out through technology. So, I would say the way that you address the remote locations changes over time, but the heart and soul of making sure that there's equitable access to healthcare never changes. That has been really a critical piece for us, is that we believe that everyone, no matter how poor they are, should have access to high quality healthcare at the lowest possible cost. So, even bringing technology in has been around management of resources to make sure there's strong and robust management of resources. So those have been some of the things that we've used to maximize impact and minimize the funding needed in order to provide high quality healthcare at a low cost.
That actually brings me to that question about funding. I mean, in the beginning, maybe you had your own resources to a certain story. That only takes you so far, and then you've got to reach out. So how did you navigate that? Because I know that's a big hindrance to a lot of people who want to do something, but they just don't know how to access it. It's not like the funding isn't available. It's out there. There's a lot of money flowing around, and like the saying goes, right? God owns it all. So there's lots of around, but how do you, how do you access it?
Well, you've opened Pandora's box, and this is the reason. Initially, as you said, we used our own funding. I owned a business in the United States, and we used that, and we were very efficient, very careful with how we expend that funding and everyone else's funding. When we got to a certain point and our funding was exhausted, we went to our family and friends. Hey, we're here. This is where we believe God wants us to stay. Can you help us? And if you take us up to 2018, we were taking care of about 50,000 patients a year. Well, in the last 5 years, that's grown by 300%. And our cash resources have only grown by 6%. And this happened during a global pandemic where the acuity or severity of the care that you needed to give. I mean, before the pandemic, we had 4 ventilators. We now have 60 ventilators, just to give you an idea of like the scope of critical care. And once people understand that you can go on a ventilator and you can live something you would have died from prior, they want a ventilator. And we want to give them a ventilator. But there's cost associated with those things. And so this is something we've been navigating, trying to navigate very carefully. It's has a lot of arms to it. As you can imagine, last year, our team took care of about 28% of the nation's healthcare. So once you start looking at it at that scale, it obviously needs government's investment. And so I think there's a balance between continuing to ask from overseas and making sure that we are honoring our social contract with the country. And so it's a balance for us. I'll be honest with you, this is not something we've done super well. Where we've been really strong is using funding and resources efficiently, but actually sourcing additional partners over time, we have not done that well. So in certain areas, we're very mature. In other areas, we're very infantile, and we're trying to fix that. We're trying to correct that. Some of the things that we've built over time, like the digital system, we're working to take that to market outside of Eswatini so that we can, because there are some trends that I think we need, those of us that work in health and development around the world have to be very careful about. Like PEPFAR wants to be phased out by 2030. The United States government, many of the multilaterals want to be phased out of HIV care by 2030. That's right around the corner from a funding perspective. And we receive, a pretty substantial amount of money from the United States government for HIV and TB work. So if they're phasing out, we have to go to new funding models. And it hasn't been easy. I'm not going to sit here at all and tell you that it's been easy. I'll be lying to you if I said it was easy. It's not been, but it's a crucial pivot for us to make. That will we always need external funders, external donors, your more traditional type of donors? Yes. But should that be the only source? I firmly believe from a business perspective, no. But you're taking someone you're taking an entity that's driven by compassion now, and you're telling them to flip that to a profit type of mentality. It is a stretch and it's a bend for us. But we're trying to embrace this like we've had to embrace a lot of other pivots over the years. So this is something that we're still working on, and it's because of the growth. It's like a hyperbolic explosion. Once people find out they can find high quality healthcare, and you have digital systems that manage resources, so drugs are always available. And that's the biggest issue that we have in our country, is that we have the resources, but the leakage in our supply chain at national level. And I'm not talking about anything that's not pretty similar in other parts of the world and in our continent. But I really believe that the resources that we need are already in the countries we're working in for the most part. It's the management of the resources and the use of, in our case, digital technology and deep investment in staff development. So they understand that having this commodity in stock is actually linked to saving your mom's life. That's the approach that we've taken. We're taking care of our own family members. So when we don't manage resources well, it may mean that my mom dies. And once you put it through that filter, for us, it's been totally different, especially because in most African contexts, we're in a collective type of environment where we're looking at this as a group, not as an individual. So, making that pivot, and like my husband said last year, the more we do, the more potentially can be corrupted at national level. So are we really helping by doing more? Finding that balance is something we're still working on. On the flip side, we don't want to sit back and wait for everything, all the eggs to be in one basket. When will corruption be less of an issue in a continent like Africa? You and I can debate on that for a long time.
Yeah.
What is our role in advocacy? What is our role in reform? And then what is our role at looking at how we do business differently? And I think, again, it comes back to the combination. It's not one or the other, but it's combining several different approaches to reach the solution that you're looking for, which is, again, to have equitable access of healthcare, high quality healthcare. Should a person who has a broken hip because they're poor lie in their bed until they have a blood clot and die from the blood clot just because they're poor?
Yeah.
So how do we find that balance to ensure that they can access a hip replacement if that's what they need?
Yeah.
And I do believe that we can do it with the resources that are there. So that a lot of our work now has been going into advocacy, also taking some of the solutions that we've built into other markets, proving concept, proving impact, and then praying that will loop back around to actually reform and change, especially in how our resources are managed in the country that we've all committed our life to. It's our first love. Eswatini is our first love, but it's a country of 1.3 million people. There are 8 billion people outside of that country that could benefit from some of the solutions that have been built in Eswatini. So I would just, for us, it's just that continual learning, growing, never thinking that you've arrived. This is an area we haven't arrived. We're still trying to learn and grow and do what needs to be done to continue to make sure that people like my example of a hip replacement don't lie in their bed and die because they couldn't access healthcare.
Yeah. Do you ever feel like it's overwhelming? Like, how are we ever going to do all this?
It is overwhelming at times. But what I can say on the flip side of that is having a united team changes that whole dynamic
Mm,
because you're never carrying out on your own.
yeah.
You're never standing alone. We've worked really hard internally. If you look at the people that work for our institution, we have 700 people from our local country. Most of them were orphaned during the worst of the HIV crisis. They're adult orphans. And they have not had a place where they belong or that they can call their own. So a lot of our work internally has been, how do we make this a place that people are safe, where they belong? You are bridging more of the family work relationship because sometimes people don't have any family members. So how do you make a space where they can also be safe personally? Because when personal things happen, we all know that boomerangs back on the work that you're trying to do together. So we've spent a lot of time building this safe place. And what I can and unity, that then breeds unity because people feel safe with each other. Don't feel like we're trying to push anyone out or get rid of anyone. But if you have a problem, we can discuss it, we can work on it together and find solutions together, even if it falls outside of the workspace. So we spent a lot of years doing that because we recognized how wounded people were from all this trauma and grief that has happened to them over their life, that they never had a place to process. So that has influenced a lot how we've approached staff development, leadership development. In fact, our onboarding process is 10 weeks long, mostly in classroom and other type of engagements that allow people to be able to process things that have happened in the past. And we have felt that this has really been able to kind of clear the deck so people can become healers. You can't really heal when you're wounded. And obviously it's a lifetime journey, to healing. But those first few times that you realize that, oh, healing is really for me. It's not for someone else. It's for me. And I can thrive. I don't have to survive. That's what we've seen in our staff. So when you talk about overwhelming things happening from outside, what I can tell you, Nicole, we do not have internal issues. When we are working on something, it is always external. And when you feel safe from the inside, somehow the external things don't seem so overwhelming.
Mm-hmm.
What is very sad and heartbreaking at times is that in the last year, for the first time ever, we never said no to anyone for the first 19 years. And in the last year, because of the sheer numbers and trying to balance that vis-a-vis the budget, we've had to start putting some filters in place as to who we see and who we don't see. That's painful.
Yeah.
That's very painful. And it's not just painful, overwhelming for me. It's painful and overwhelming for the whole team. It also is a motivator to go find solutions.
Yeah.
And, some of the things we're doing now, it's not what we thought we would be doing, but we're doing it because we don't want to turn anyone away that needs access to healthcare. So the overwhelming part, I would say, is very much balanced by having a united team. It's the only way that I know to cope.
Yeah. Well, there's so much there in the way that you're supporting your team that I think even business leaders here in the US can learn a lot from, because I think the disengagement levels, because some people who are listening are looking to, that maybe they want to do something similar to you, and some just have a business and they're like, what can I learn from this? And even for what we're doing here. But that unity, what you're talking about, having a team that you're basically working together to create the outcome. Unfortunately, the disengagement is like so high in organizations because they don't have that, and I think part of the reason why they don't have that is because they don't have that kind of mission and connection to the mission, right? Where a lot of times people are just going to work to get a paycheck. And so there's a lot we can learn about that. And that's probably a whole other podcast. But I did want to ask about the fact that, like you said, you're serving 28% of the population and healthcare needs in that country, and you're a faith-based organization. And with, I think you said 316 chieftains or whatever, like that's a lot of different religions and whatever things that are going on there. How do you navigate that with the government? Because you said you have government support from the US, and obviously you've got to work in conjunction with government, governing bodies there. How do you navigate and bring your faith into this without ostracizing or causing it to be a problem because they're not in support of your faith journey or whatever, like what I'm saying? Like, how do you bring those two together and address that?
I would say the journey for us has really been faith in action. I
Okay.
believe faith is why we do what we do.
Mm-hmm.
It's why you don't give up. It's why I haven't
Mm-hmm.
packed bags a million times and said this is too hard. It's because you were called. Your anchor, your hook is your faith, your calling. Obviously, we want to minister to people spiritually if they desire it. We don't force it on anyone.
Mm-hmm.
It is one of the things that's offered. You can go to the dentist, you can go to the eye department, you can go to the spiritual care department. It's one of the things that's offered. I would say that our journey with the United States government has been so refreshing because actually they're very logical and direct and straightforward in how they separate these two things in an environment like ours. We cannot use United States taxpayers' money to do spiritual work. And we cannot force anyone to engage in spiritual activities or religious activities in order to access healthcare services. Well, those things were never happening before the United States government was even involved. No one has ever been forced to engage in any kind of activity in order to access healthcare services. And so for us, I would say it's more of a faith tapestry that it's embedded into everything you do, but it's your motivation for doing it. And if others want to engage in it, then of course we are always open to engaging in that, but it's not something that's forced. That's how we've approached it. At times, I'll be honest with you, Nicole, we are criticized by especially the faith side of the equation for not being more vocal or more, I would say vocal would be, but we see faith as very relational. So, for instance, we have a lot of people that visit us to do residency programs or, medical students and those kind of things. When they come over, if they want to engage, if they see something that spikes their interest around faith, we engage with them on that. But we want people to be able to journey and walk with us, not be inclusive, exclusive. And sometimes I think in the very vocal environments, it makes you feel in the out group. We don't want anyone to feel in the out group, whether it's a staff, a patient, or as I've mentioned, we do have volunteers that come over for short periods of time. Many of them don't have a faith background, and we want them to be as welcome as someone who maybe resonates with the same faith background that we do. So that's also been, trying to find a balance where everyone feels comfortable with that has been a little bit difficult. Not with the United States government. I can say that has been they've just been, they call us their leading faith-based organization in the country. I mean, how much more can you ask from them that they recognize that faith's the reason you do what you do, and it's the thing that gets you out of bed every morning and makes you not give up. That's what it is for me. Obviously, extraordinarily important to our life, but we just want to avoid that in-group, out-group, inclusive, exclusive type of feeling that you get at times. If I'm not who you are, I don't believe like you do, then I'm not part
Yeah.
of the group.
Yeah, and this happens a lot, actually. Unfortunately, it does seem to happen quite a bit where organizations are either too much and people say, oh, that's the only reason why they're doing it. And then the other side, like you said, you even can get criticized because you're not doing enough. And it's like, I think if you're following what God is leading you to do and being his hands, being his feet, I think of Jesus when he healed him. He didn't qualify, their faith and how much it was like heal first. And then, they are like, who is this?
Yeah.
And then you can have a further conversation about that once you've actually taken care of their immediate needs. And as a believer, it's like, wow, why don't we just, what if we were just to be God's, hands and his feet and love people, follow his commandment, which says love God and love one another as ourselves, and let him deal with the rest. We don't get people saved. We don't, we can't force people to believe a certain way. And why would we? It's like, it's their journey. And God is gonna, show up for them however he shows up. And maybe it's through us one day, and maybe it's through somebody else another day, and maybe he's, speaking to them in their own quiet time and inviting them into a relationship with him. And so it's not a thing, it's not like an act that you have to like, strategy, like you're talking about strategy, like trying to orchestrate, and I think that happens a lot.
Hey,
So
we're looking for opportunities to serve people,
yeah,
whether it's physically, mentally, emotionally, spiritually. When those doors open, we walk through them,
yeah,
no matter what the type of healing is that people are looking for. But we want them to open the door for us so
yeah,
that they can receive, no matter what the intervention is, in the right spirit or the right heart. And, I can just tell you, like, I've seen the most beautiful things. We have a very dedicated spiritual care team. And during COVID, it was just like, we didn't have enough oxygen in the country. We ended up building an oxygen plant in the middle of COVID. I mean, it was a war zone, and
yeah,
most of the hospitals weren't taking patients, and everybody was coming to us. And then we had to make a decision. Are we going to take people even though we don't have the one thing they need, oxygen? And then it was like, well, if it was my mom, would I push her on the street? No, I won't. So I'm going to take care of her, even if the only thing I can do is hold her hand and, like watch her die or be with her while she dies. So that, because, I watched our spiritual care team just in bed with our medical team and be there. The gift of presence is such a big deal. And
yeah,
they did things that are happening even today that we learned during that time. They were there for every change of shift, 6 a.m., 6 p.m. Any staff member, any patient who wanted spiritual care, they were available to them. They were there probably, 8 to 10 hours a day during COVID. And it was crucial because you had people who had lost their parents or very close family members during the HIV pandemic. Now they are serving in another global pandemic where people are dying right, left, and center very quickly. I mean, we have people come in, say, I'm going to die, 5 minutes later, they'll be dead. I mean, it was like very acute, different than other disease processes when you watch somebody suffocate to death. And the fact that that spiritual care team is on standby next to you and next to the team, we didn't have anyone abscond from work. We did not have burnout. We didn't have, and I credit it to that gift of presence. They were there and available. They weren't shoving anything down anyone's throat. They were like, if you want support, we are here. And I believe that gave the team a resilience we would have never had without that. But it wasn't shoved down our throat. It wasn't on a billboard. It wasn't in writing. It was humans who were there journeying in a wartime or a battlefield type of environment. And I I really believe that's what people who are hurting are looking for.
yeah,
So
yeah,
we feel that we are capturing every opportunity that God puts in front of us, no matter what the type of healing is. Sometimes it does not translate, I would say, especially to the United States, the way they would like to see it translated. But I don't believe that it's wrong. I feel it's relevant and it's practical.
mhm,
And if God tells us to redirect, change the approach, we're going to do that. But right now, what I see behind the curtain is something I never thought I would see in my life. It's just a practical walking out of faith that is beautiful and messy, because that's who we are. We are messy, but God made us beautiful, you know. So we are really trying to just follow what the Holy Spirit wants from us, even though it may look a little bit different than things look like in the first world.
Yeah. Echo, I just love this. And I think that's a really great place to end and just leave our listeners and our viewers with kind of a, some things to think about as we operate in our day to day. What you're doing there is applicable here and anywhere that someone is. We don't have to go somewhere else. It's like the mission field, even though you don't call yourself missionaries, but it's like the mission field is here, right? In terms of like, can we love the neighbor? Can we love the person right next to us? Can we love the stranger that we come in contact with? Can we serve? Can we be God's hands and his feet in a hurting world? And so I think it's just beautiful what you're doing. So thank you. As we wrap up, would you be just willing to pray for all of us and lead us out in prayer, and then we'll wrap up. We'll make sure, of course, that they have your website, lukecommission.org. People can learn more about what Echo is doing and their whole team and this amazing like oxygen plant and all of the things. Go on their website if you're out there and you're curious about it. Go to lukecommission.org and find that. Of course, that's also going to be in the show notes, and we'll have links to their social media and all of that, so you can connect with them. But yeah, let's just let's finish up with a prayer, and for all of the aspiring leaders of transformation that are out there that want to make a difference in the world.
Sure, I'd be happy to do that. Dear Jesus, thank you for this time you've given us together. And God, we just kneel before you and ask you to guide and direct each step and each decision that anyone listening has in front of them. We want your will and your way. We want to follow your leading. And we want to see you move in a way that we could never see in a pure human sense. God, we're looking for your miracles. May we just follow you. And as Nicole has said so many times, be your hands and feet. It's a beautiful image that you're the Godhead, but without us being your hands and feet, you cannot action the things for this world that you want. And we just ask for healing in so many areas of the world that are needed, God. We ask for your supernatural presence to invade and bring restoration and reconciliation in a way that we can only attribute to you. We love you and we thank you for this time you've given us together. In Jesus' name, amen.
Amen. Amen. Echo, thank you so much. This has been inspiring, such a pleasure to learn more about what you're doing. And I'm just going to encourage anyone out there that wants to support as well what they're doing out there. Yes, they need some larger funders. If you happen to know family foundations and private, institutions that can fund on a larger scale, to reach out to them. But even a small scale, everything helps. Every dollar helps to be able for them to continue to do the work that they do. And so, again, lukecommission.org is their website. You can go on, find out more about it and support them there. So again, Echo, thank you so much. God bless you. God bless your team. And we'll look forward to continuing watching the journey as it unfolds.
Thank you very much, Nicole. Thanks a lot.